what we're going to do now is I want to mix it up a bit, because for us, making connections is in our DNA. So I thought, well, one of the things we could do is look at not just our ecosystem that we've got in Belgium, but also please colleagues from Germany and the Netherlands, because here are three slightly different ecosystems. Now, I kept the Medvia colleague up because I want to see how they play nicely with each other. Because obviously we can do a deep dive into Belgium, but I want to know what's happening in Germany. Germany is very, very interesting for a lot of organizations. They always say, well, there's a we're really interested in how they're implementing digital health in Germany, but also in the Netherlands, because why wouldn't we? We're here in the Netherlands today. So we've managed to bring in ecosystems from both the Netherlands and Germany to add to that mix today. So, without further ado, I'll let them do the talking instead of me. Health Valley, what's happening in the Netherlands?
What's happening in the Netherlands? Yeah, a lot, I think, today, especially here in Amsterdam. My name is Helma.
We switch that mic? Take the next one.
Okay. Well, thanks, Andy, for the invitation. So happy to be here in Amsterdam. So I'm Helma. I'm working at Health Valley in the Netherlands, and we are a network organization, I think quite a lot resembling what Isabel already talked about in Belgium. So we are located in Nijmegen. It's in the eastern part of the Netherlands. Like said, Belgium can be divided or consisting of different parts. I think in the Netherlands it's also the same. You see a lot of differences in different regions, cultural differences, also in language, some differences where you have to deal with when you are a network organization as well. So I will tell you a little bit more about what we are doing in the Netherlands at local level, regional level, but also at a national and even an international level. So we are a network organization also consisting of a lot of different partners you see on the right side, for you on the left side on the slide, where they are all coming from. So we have citizens representing their healthcare organizations, different companies, also knowledge institutes, and also the government is there. So we have a mixture of over 200 partners that are active, mostly in the eastern part of the Netherlands, but we are covering more of the country itself. On the other side, you see some logos of partners that we have in there. And in the middle, I think it's been mentioned quite a lot already. We have 3 pillars: connect, challenge, and grow. I think connect is the main part, what we do. If people ask me, what's your job? I always say, yeah, we drink a lot of coffee, talk to people, try to connect them. And yeah, that's in a nutshell what we do a lot. So you need to know what your partners are doing, what's happening out there, and try to put them together. Because if you have a startup, they very often don't know what they are doing, what they all have to deal with. And if you can bring them and connect them with people that know more about it, you can really help them as such. So you can help them in the whole landscape of things. So within Health Valley, we have, next to the Connect, Challenge, and Grow, we have, are working on 3 items. It's digital health, like already said, that's an important item, but also on prevention and sustainability in a broader sense. Also on human capital to maintain talent in places where it is. I think that's in a nutshell what we do on the national level, but we also help the startups and other companies if they need money. You mentioned also investment. Unfortunately, we don't have our own 9 million a year to give away, but we can help companies either to land in the Netherlands. So if you would like to expand a business from another country towards the Netherlands, you can always get in touch with us, and we can find and help you find your way within the Netherlands. We work together with OostNL. I think it's a logo at the bottom of the slide. They have also investment funds can help you with starting up your company so that you get some money to build it, but also with European funds. We try to bring together partners in consortia. We are also ourselves partnering consortia. We can help you writing projects. I think, like most of the network organizations can do. And since we are close to Belgium, Germany, I think the Interreg kind of projects we look at, and you see a lot of differences between the different countries, which is good to know, but also quite some similarities in same struggle where we can learn from each other. And I think that's very important where we try to build on. I think that's in a nutshell.
Okay, thank you for that.
What-
So in terms of what connectivity do you have currently between Germany, other than the Interreg programs? Do you do trade missions or?
Yeah, we do trade missions also together very often with OostNL or with Go for Export. That's a larger thing. So with Germany, we go to the Medica, for instance, on an annual basis. With an Interreg project, indeed, there's also Belgian partners involved. And I think, there is always room for more opportunities. Also, of course, you need to have the people.
And when's your annual summit? You have an annual summit too?
In December, I will write it down on my calendar.
Okay.
So that's not that far away for us, so that's good.
Excellent.
You know, I think it's good to have these kind of initiatives, and especially if you have such a huge network attaching all the networks that are out there already, you bring together a lot of knowledge, and you can share that knowledge in an easy way. I think that's good. Yeah.
Can I add something to
Please.
that? When you're working with cluster organizations like we are doing, what I find really of much added value is the fact that you can ask your counterpart in a cluster, like we're looking for a startup or the university or whatever, with this kind of expertise, this is the topic, this is the requirements, do you know somebody? And then they take you by the hand and put you next to the relevant person. Try to do that without having this type of cluster organizations. So for me, that's a big added value for our ecosystem. If you ask for somebody in the Netherlands, in Germany, in Spain, wherever, we say like, oh, but we have a colleague there. We can call him or her, and you go there very quickly, which is really nice.
Yeah, fully agree. I think that makes it easier. I think within our own networks we do that, but it's good to have it even bigger.
Yeah.
Yeah.
And I think it's an ideal way you can see the depth of that network we've got within ECH Alliance, where we can say, yes, we've got an ecosystem in the Netherlands, but then specifically, they've got those really good connections, the ones that answer their bloody emails, basically, in the local organisations, because that's the important thing for you as members, because we know it's hard to get connectivity sometimes with some organisations. Our local intelligence is much better. And it's one of those valuable things I always say about our network, such as the colleagues in the Netherlands. So thank you for that. I want to do another deep dive now, if I can, and go to Germany, because we hear a lot about Germany. So the expectation is high. And why wouldn't it be? Because we've got an excellent ecosystem in the Cologne-Bonn region, which I think has been a long-term player in our network. And has taken part in many of our other programs and activities in our mental health thematic ecosystems as well, and stepped up to the mark. So tell us some more about the Cologne-Bonn region, please, health region.
Yeah, thank you so much for the invitation and good afternoon. So as Andy said, we're the health region Cologne-Bonn. So my name is Nathalie Wiege. I'm a project manager at the Health Region Cologne-Bonn. As you can see, we're more than only Cologne and Bonn, so we cover 3 cities, so the cities of Cologne, Bonn, and Leverkusen, and 7 districts around. And we are a members association and have around 140 members in these regions. And we were founded back in 2009 as one of 6 health regions in the federal state of North Rhine-Westphalia. And the aim was to really connect the different players in the health sector, ranging from science to research to industry and all the other sectors from the health cluster. We have a very diverse membership, I would say. So we cover public members like the cities and the districts, but we also have a lot of private companies from research, industry. We have a lot of SMEs and startups. And we cover also the research branch. So we have universities and university hospitals and a lot of smaller research companies. And this diversity of members is also reflected in our daily activities. So we really try to be a catalyst and sounding board for our members and their interests. And as you can see on the right-hand side, we have a lot of topics and fields of action that we try to cover with our initiatives and events that we organize. So we do a lot of events ranging from more business and trade events to informal network events, and to really try to get those members and individuals together that share similar interests and want to move on with innovations and ideas. We also do have a lot of working groups, so we invite our members to be part of 6, I think, working groups, also reflected in the topics and fields of action on the right side, to get them together, think outside the box, organize events. And also one of our primary activities is to carry out projects. So we by now have a pretty long track record of applying for project funding and carrying out these projects, not only with our member partners, but also with our international collaboration partners. And so on the left-hand side, you can see some public bodies that we, funding bodies that we have secured funding from in the last couple of years. The recent projects that we had were very much focused on active and healthy living. So we just have ended a huge Horizon 2020 project called Shapes with, I don't know, I think it was 36 European partners. We also just ended an EFRIP project where we try to digitalize some care services, and also a nationally funded project I worked on where we try to connect the stakeholders in the health sector in a rural area near Cologne. And we're got awarded, luckily, with as a 4-star reference site for active and healthy aging from the Reference Site Collaborative Network. But our projects are also focused on other fields. I can tell you a bit about it later as well. We're also part of numerous European ecosystems. So as you can see on the bottom of the slides, we're part of the ECH Alliance since 2018, and we're also leading the thematic innovation ecosystem on mental health since 2020, I guess.
Yeah.
And it's a lot of fun to get connected to the other ecosystems. So we did a lot of workshops, for example, in the mental health TIE. With experts from Norway Health Tech, from Ulu Health Ecosystem, from South Denmark, and invited their experts and speakers for various subtopics of mental health, ranging from isolation to children and adolescent mental health to substance misuse. Maybe about the collaboration also between Netherlands, Belgium, and Germany. I can tell you about a recent project we have secured funded from. It's an Interact project we do with partners from Belgium, Ireland, and Netherlands. It's called Heart Safe, and I think it's a great representation of how you can really learn from these cross-border initiatives and projects. So the project is about a Dutch best practice because they have managed to implement a community first responder system for sudden cardiac arrest, where citizens get alerted on their smartphones whenever there's a sudden cardiac arrest in their neighborhood, so they can immediately go and start resuscitation. And now the ecosystems from Belgium, Ireland, and Germany, we try to implement this Dutch best practice. And I think it's very useful and inspiring to hear about the barriers, but also perspectives that, for example, the Dutch partners have made in their previous, I don't know, 10 years where they implemented this community first responder system. Yeah, so it's a lot of fun, I would say, working with these cross-border initiatives, and yeah, looking forward to carry on it.
So there you have it. You've got 3 examples of where you can do a deep dive, not just in one ecosystem, but 3. All of those have got their own connections, their own connectivity, that will enable you to have a landing zone if you need that as a company, or an implementation zone, or a policy network, or a research network as well, whether that's with Isabella, or with Helma, or with Nathalie. So big round of applause, please. Thank you very much. Thank you very much.